What are the signs and symptoms of a major case of high blood pressure? Severe high blood pressure symptoms. Headaches that are unbearable. Nosebleed. Fatigue or perplexity. Problems with vision. Pain in the chest. Breathing difficulties. Irregular heartbeat is a condition in which the heartbeat is irregular. Urine with blood in it. Sweating so much, hands and arm are numbed, usually left arm, your chest, neck, or ears are pounding. Having trouble sleeping, facial flushing, blood spots in eyes, feet, legs, or abdomen swollen. One of the most serious aspects of hypertension, often known as high blood pressure, is that you may be unaware of your condition. Nearly 1/3 of persons with high blood pressure are unaware of it. That's because, unless it's quite severe, high blood pressure has no symptoms. High blood pressure, hypertension, can harm your body silently for years before you notice any symptoms. High blood pressure that is uncontrolled can cause disability, a poor quality of life, and possibly a deadly heart attack or stroke. As the heart pumps blood, blood pressure is the force of blood pushing against the artery walls. When blood pressure is excessively high and begins to affect the body, it is referred to as hypertension. It will eventually harm the heart and blood vessels if it is not treated. Two numbers are used to determine your blood pressure. When the heart contracts, the highest systolic blood pressure measures the force pushed against artery walls. When the heart is resting between beats, the bottom diastolic blood pressure measures the pressure in the arteries. What happens if a person's blood pressure is not treated? High blood pressure is a dangerous condition. It can lead to heart and circulation illnesses like heart attack or stroke if you ignore it. It can potentially lead to kidney failure, heart failure, vision issues, and vascular dementia. Blood pressure is one of the vital signs used by healthcare professionals in assessing a patient's health, along with respiratory rate, heart rate, oxygen saturation, and body temperature. In an adult, normal resting blood pressure is 120 mm of mercury, 16 kilopascals, systolic over 80 mm of mercury, 11 kilopascals, diastolic, which is written as 120 over 80 mmHg. The best blood pressure for adult person. Since 1975, the global average blood pressure has remained nearly the same, at around 127 over 79 mmHg in males and 122 over 77 mmHg in women, despite major regions. Mild hypertension is defined as blood pressures of 140 to 150 over 90 to 100 mmHg, depending on the particular classification utilized. Pressures of 150 to 170 over 100 to 110 pounds per square inch are considered moderate, whereas pressures of 200 over 120 pounds per square inch are considered severe and dangerous. Solution must be undertaken by every one of us. If your second or third blood pressure reading is still 180 or higher after a few minutes, don't wait to see if it will go down on its own. As soon as possible, dial 911 or your local emergency number. Severe consequences can occur as a result of an emergency hypertensive crisis, including in pregnant women with eclampsia, fluid in the lungs, brain swelling or hemorrhage, and a tear in the aorta, the body's main artery, can cause seizures. High blood pressure is often the first sign of a major underlying problem. When a patient presents with high blood pressure, doctors will examine their urine and renal function, perform an electrocardiogram to determine the size of their heart, and examine their lungs for any abnormalities. Reduce your blood pressure for the sake of your head as well as your heart. Even if you forget that high blood pressure is dangerous for your brain, keep in mind that men with normal blood pressure live around 5 years longer than men with high blood pressure. Understanding your blood pressure is the first step. Knowing what you want to achieve is the next step. Finally, live a healthy lifestyle. Blood pressure can be reduced by making lifestyle changes. It is a critical component of high blood pressure prevention and treatment. Here are things you can do to get started. 1. Limit your daily sodium consumption to less than 2,300 milligrams. 2. Moderate exercise is beneficial, and in some cases, it even outperforms vigorous activity. Walking for 30 minutes or to an hour a day can reduce your systolic blood pressure by 5 to 12 mm Hg or more. 3. No more drinking alcohol. 4. No smoking, quit as soon as possible. 5. Don't eat pork and red meat. 6. Controlling your stress level. 7. Finally, drink your medications religiously as prescribed by your family doctor, as I do every day also, to make you life easier and longer. Thank you for watching. Please like, comment, and share with people who might find this material beneficial. Also, please like, follow, and subscribe so that I can make more videos that you want to enjoy viewing it.